Ever wondered if your heart is healthy or if it's in a bad shape? Today we will discuss the 7 signs in your body that may indicate your heart is not in optimal condition. Cardiovascular disease is the #1 killer in the world. We'll break this video down into 3 parts. The first part will be about the 7 warning signs to look out for that can indicate your heart is calling for help. We will explore what you should look for when you are looking for early signals of heart trouble. In the second part of this video, we will discuss the 7 classic symptoms you may feel when your heart is not doing well. Could you or a family member be feeling them? Finally, we will give valuable tips on how to avoid heart problems in the future. But first, before we start, please like the video, because the more people like it, the more YouTube will distribute it to people who do not have access to doctors or hospitals. Your contribution may be helpful. Also, please share the video with your friends and family. Many lives can be saved with your help. We live in a world where cardiovascular disease has become the #1 global killer, claiming an astounding 17.5 million lives every year. Knowledge is power, and recognizing these signs early can be a lifesaver. So, what are the 7 signs to look for that could indicate you have a heart problem? These are visible indicators, things you might see in the mirror or notice on your own body or on someone else's. They are subtle, yet significant. Let's dive in. Number 1. Look out for a diagonal crease or wrinkle in your earlobe. This is known as Frank's sign, a seemingly insignificant detail. Yet, research published in the American Journal of Medicine suggests a strong correlation between this crease and coronary artery disease. Number 2. Pay attention to hair loss on the legs. A study in the Archives of Dermatology linked lower leg hair loss with cardiovascular disease. It might seem odd, but it's all about circulation. Reduced blood flow to the legs can cause hair to fall out, as the hair follicles are not getting the necessary nutrients and oxygen. The skin on the legs may also become shiny, pale, or thin. Number 3. Xanthelasma. These are strange yellowish fatty deposits around the eyes. According to a Danish study in the British Medical Journal, they could be a sign of heart disease. These deposits indicate high cholesterol levels in the blood, which is a risk factor for atherosclerosis, a condition where plaque builds up in the arteries, leading to narrowed or blocked arteries. This can increase the risk of cardiovascular problems such as heart attack and stroke. Number 4. We have arcsenile or halosenile. This is a gray or white arc visible above or below the outer part of the cornea of the eye. It is caused by lipid, fat deposits, and is often associated with high cholesterol levels, which are a risk factor for atherosclerosis. Don't confuse them with cataracts, though. The Journal of Gerontology reports arcsenile may indicate high cholesterol, which can lead to heart issues. Number 5. Cyanosis. If your lips, tongue, or skin appear bluish, it might be due to low oxygen levels in your blood, a possible sign of heart disease according to the Mayo Clinic. The heart's inability to effectively pump oxygenated blood to the body could lead to visible cyanosis, particularly in the lips, fingers, and toes. Keep an eye out for this. Number 6. Ulcers, particularly leg ulcers, which can be a sign of peripheral arterial disease, a risk factor for heart disease, as reported by the American Heart Association. Number 7. Swelling of the legs. This could be a sign of heart failure. The heart can't pump blood efficiently, leading to fluid buildup, as outlined in the Journal of the American College of Cardiology. These visible signs are important to look out for, but the symptoms you feel can be just as crucial. So stay tuned as we delve into those in the next part of our discussion. If you find our video interesting so far, please kindly give it a like. Help us share this video to others. Your contribution could save lives. Moving on to the 7 classic symptoms that can indicate a problem with your heart. These are signs that your heart might be trying to tell you something, so it's crucial to pay attention. Number 1. Shortness of breath. It's normal to feel a little out of breath after a strenuous workout, but if you're feeling winded after simple activities, or even at rest, it's a major cause for concern. Medical studies have shown that difficulty in breathing can be a sign of heart failure, as the heart struggles to supply the body with sufficient oxygen. Number 2. Persistent cough. A cough that doesn't go away might be more than just a common cold. In some cases, it can be a sign of heart failure, as fluid builds up in the lungs. Number 3. If you're experiencing shortness of breath when you go to bed, you should take it very seriously. This might be due to the heart's inability to pump blood efficiently. Lying down can make this worse and can be a sign of heart disease. It can also be a sign of a mental disorder like anxiety, so make sure to get it checked in order to rule out any heart problems. Number 4. generalized weakness. If you're feeling unusually fatigued or weak, it could be your heart's way of telling you that it's not pumping blood efficiently. Research has linked chronic fatigue to various heart conditions. Number 5, nocturia. This is the need to urinate frequently at night. This could be a sign that your heart is not able to pump blood efficiently, leading to fluid accumulation in the body. Number 6, intermittent claudication. This is muscle pain or cramping in your legs or arms that's triggered by activity. This can be a sign of peripheral artery disease, which is linked to heart disease. Number 7, chest pain. This is perhaps the most recognized symptom related to heart trouble. If you're experiencing chest pain, especially if it's combined with any of our other symptoms, it's time to seek urgent medical attention. If you're experiencing any of these symptoms, please visit your doctor as soon as possible. Remember, early detection can save lives, and it's always better to be safe than sorry. Now that we know the signs and symptoms to watch out for, what can you do now to prevent heart problems in the future? First on our list is getting regular exercise. Physical activity is key for a healthy heart. It improves circulation, helps to maintain a healthy weight, and can even lower blood pressure. Aim for at least 30 minutes of moderate intensity exercise most days of the week, and remember, every little bit helps. Secondly, if you smoke, quit. Smoking is one of the leading causes of heart disease. It damages the lining of your arteries, reduces the amount of oxygen in your blood, and increases your blood pressure. The good news is that it's never too late to quit, and the benefits start almost immediately. If you're overweight or obese, losing weight can make a big difference. Carrying extra weight puts extra strain on your heart and increases your risk of heart disease. Even a small weight loss can have big benefits for your heart health. Next, let's talk about diet. Eating healthy is crucial for heart health. Incorporate plenty of fruits, vegetables, and whole grains into your daily meals. Opt for lean proteins, like fish and poultry, and use olive oil instead of butter or margarine. Fifth on our list is watching your cholesterol levels between meals. High levels of cholesterol can cause plaque to build up in your arteries, leading to heart disease. Foods like oats, whole grains, and fruits and vegetables can help lower cholesterol levels. At the same time, try to limit foods high in saturated and trans fats, which can raise your cholesterol levels. Keeping your blood sugar under control is also critical. High blood sugar levels can damage your heart, blood vessels, and kidneys. If you have diabetes, work with your healthcare provider to manage your blood sugar levels effectively. Lastly, controlling your blood pressure is vital. High blood pressure is a major risk factor for heart disease. Lifestyle changes like eating a heart-healthy diet, reducing salt intake, getting regular exercise, and managing stress can help control blood pressure. If lifestyle changes aren't enough, medication may be needed. Implementing these prevention tips can make a significant difference in your heart health. It's never too early or too late to start taking care of your heart. Remember, small changes can add up to big results. So let's start today for a healthier tomorrow. Your heart will thank you. Heart health is very serious. If you think you have a heart problem or if you've experienced any of the symptoms mentioned, please visit your doctor as soon as possible. Your heart, like any other organ, sends out signals when it's in distress. Recognizing these signs and symptoms early can be a game changer. It can save lives. This is the aim of this video. Remember, these signs and symptoms aren't definitive proof of a heart problem, but they are worth discussing with your doctor. They can guide you on the right path to diagnosis and treatment if necessary. We're all in this together. The more we know, the better we can look after ourselves and our loved ones. So, let's share this knowledge. Share this video with your friends and family. You never know whose life you might be saving. If you found this video helpful, please don't forget to like and share. And if you are new here, make sure to subscribe to our channel to not miss out on our daily health content. In the meantime, check out our other videos. We give out plenty of useful information that can help you stay healthy. If you have any interesting health topics you want us to talk about, please be free to share in the comments below, and we will consider covering it next. Until next time, stay healthy.